So next presentation will be presentation number 8, Dr. Hong Ki Nang. Is it okay? The presentation is titled Establishing Steroid-Induced Glaucoma Registry as a Catalyst in Enhancing National Eye Database towards Improvement of Big Data on Ophthalmic Diseases in Malaysia. Over to you, Dr. Hong.
Thank you very much, Professor Madhu. Good morning, everyone. My name is Hong Ki, and the topic of my project is establishing a steroid-induced glaucoma registry as a catalyst in enhancing the national eye database towards improvement of big data on ophthalmic diseases in Malaysia. So there's no conflict of interest pertaining to this project. So medical registry is an important health data set used for research, quality improvement, and public health monitoring. In Malaysia, we have National Eye Database, which is owned and run by the Ministry of Health MOH, involving 48 public hospitals throughout Malaysia. It is mainly used for cataract competency monitoring among the trainees. However, the NED doesn't have the participations of those outside the MOH, for example, the universities, private ophthalmologists, as well as army hospitals. And it doesn't cover well of the other ocular diseases besides the cataract surgery. So thus this project hopes that we can incorporate everyone on all the spectrum of the ophthalmic diseases, and we can create a truly reflective of the Malaysian Eye Disease Registry, MEDR, with the SIGR as the first steps towards the improvement of the big data in Malaysia, which is important for the policy making as well as the prevention of blindness policy in Malaysia. So this project is divided into 3 phases, which the first phase is to identify the barriers and the possible solutions in integrating this SIGR into existing NED, and moving on to address the issue of integration and establish the SIGR, and lastly to expand using the SIGR model to other subspecialty diseases towards the improvement of big data in Malaysia. So in phase 1, I used a SWOT analysis model to determine the barriers and the possible solutions. So the strength of this project is that there's a large member representation and the financial ability of the society, the national society, and the presence of the academicians within the society itself which can aid in the project. The witnesses include the divisive idea within the Ministry of Health as well, and within the society members and between the both systems, and also lack of the leaders to spearhead the project. The opportunities involve this current existing system, which is the NED, to make it easier to integrate the existing system into the current systems. And also there's better collaborative effort between the MOH and the non-MOH side at the moment in terms of the parallel training program as well as conjoined ophthalmology symposium. The threats include the governance concerns, the data privacy and ownership, as well as the financial support to maintain its sustainability. So after the SWOT analysis, so this is a table showing the barriers and the solutions. So for the data and the governance, I need to engage and advocate to the stakeholders as well as the possible decision maker with a written MOU on the data issues on governance. For fundings, I need to find a value for money packages of the vendor or the tech company and identify the potential source of funding to make it sustainable. For this suboptimal collaborative mindset, I need to advocate to all the ophthalmology members and make them understand this is important and it's for the future of the nations. For the internal issues within the MOH, like for example the rate tips, you need to engage someone, a key person within the MOH itself to smoothen the technicalities challenges. So there was a few rounds of engagement and discussions between the stakeholders, namely the chairperson of the NED in the MOH, the National Society, the technical support team, and myself to understand more about the current NED setup, our idea of the MEDR as well as the SIGR. Upon which we submitted a proposal based on these guidelines and sent to the National Institute of Health MOH for its merit assessment. The proposal underwent a few rounds of revision and submitted back for NIH for reassessment, and the concern about data, governance, ownership, and sharing are also detailed out in the proposal. Furthermore, I also got a support letter from National Head of Ophthalmology Services from the MOH Malaysia. In terms of the financial support, we're able to get the best deal from the vendor with experience, and the society is agreed to support this project. So this is the latest version of the SIGR notification form, which we plan to launch it during the inaugural Malaysian Ophthalmology Scientific Congress, which is supposed to be by end of this month upon approval from the NIH. This is the best platform to advocate of this MEDR and SIGR because this is the biggest national Ophthalmology Scientific Congress in Malaysia, and it's also important because this is the first time whereby there is a collaboration between the MOH, the university, as well as the societies, and from the Army Hospital as well. So my project currently is at the second part of the phase 2. Our achievement so far is that we're able to identify the barriers and solution, engage and advocate the stakeholders, look for the feasible vendor and find support financially, and the SIGR design is to process advocacy activity with fully integration into NED once the approval from the NIH. And in the future, which include to use the data from the SIGR to study the incidence and the association factors, and later on to move on to phase 3 to expand using this SIGR model into other subspecialty diseases, and later on as the backbone for the big data of ophthalmic diseases in Malaysia. Before I end, I would like to acknowledge my supervisor, Dr. Sherman Valero and Professor Lil Shamini, as well as those important in this project. And thank you very much.
Thank you very much for that nice presentation. Any questions from the audience? Any comments?
Congratulations. I didn't think you will get this far because it was a very difficult project to begin with when I was reading it at the beginning, but kudos to you. I think this is really where you see the importance of getting all the stakeholders involved. You know, there's ownership for everyone. So again, another tip for you who will be doing large-scale projects like this. Get people who you will work with, give them ownership of the projects as well. So congratulations.